Hi, I'm Dr. Greg Grillo with ExpressDentist, and we're here today to talk a little bit about oral cancer. You may have heard of oral cancer or known someone that's dealt with it, but it's a very serious condition and something that it's good to know a little bit more about. This is something that afflicts at least 50,000 people a year in the United States, and it can be a very deadly form of cancer. And most of the people that are involved are smokers, but non-smokers can be as well, and both men and women. So there's a few things to be aware of, and let's dive into them. First of all, when we talk about oral cancer, we may be referring to two different types of cancer. It's not one and the same. So oral cancer really refers to a cancer where there's changes in the tongue, the floor of the mouth, the lips, the cheeks, that kind of thing. And usually it is from tobacco use. That's traditionally the issue. It can also be from other types of things, even, believe it or not, poor fitting dentures or chronic irritation, like if you're always biting your tongue. This can be a very aggressive form of cancer, and it can be fairly difficult to treat as well. But what's the second type? The second type is oral pharyngeal. And oral pharyngeal refers to the area at the back of the mouth, and that includes the back of the tongue and the tonsils, the upper throat. And we do know that the same things like alcohol and tobacco and trauma can be causes for that. But actually, what we've learned in recent years is that the human papillomavirus, or HPV, is the most common cause of this condition. And this is a sexually transmitted virus, and it's often known more commonly for cervical cancers as a cause there. But it is now something that is being seen as a cause of oropharyngeal cancer. So there's a couple of different causes that you need to be aware of, and you may need to make a decision with young people whether they should have the vaccine for HPV or not as a result of this. And another fact, number two, is that one type of cancer is moving downward in prevalence, but the other one is on the rise, especially in younger people. And based on what I just told you, you may be able to figure out which one is which. So yes, there has been a decrease in tobacco use, which over time has reduced the number of oral cavity cancers. It's often seen in older people, but on the other hand, what's happening is that there's a rise in these oropharyngeal cancers, and often in people in their 50s and 60s and even younger, and it's directly related to sexually transmitted HPV infections, which has been established in the research. So this is something definitely to be aware of. And number three, you may know this, I mentioned it earlier, but oral cancer can be very serious. And it turns out that more than 50% of the people that are diagnosed with oral cancer are going to live longer than 5 years, but that means that a lot of people aren't. And so it makes it the sixth leading cause of cancer death in the US. And that obviously is pretty troubling, and because these can be fast growing cancers, and they can just go unseen because there's not often a lot of pain. Now, I will say that those cancers we mentioned earlier, the oropharyngeals that are HPV related, they have a much better prognosis, and 80 to 90% of those people will be alive beyond 5 years. But these are all very serious to consider, and the treatment that goes into taking care of oral cancers is also a very serious issue. So number four, you should check regularly for any signs of cancer, because we want to catch any cancer early, and certainly oral cancer or oropharyngeal cancer. These are cancers that you want to get as early as possible. And so what you really look for is anything that persists in your mouth for more than 2 weeks. It's a good rule of thumb. thumb. So if you have like a mouth sore that's not healing, just staying the same, or you have a lump, some type of a bump that seems to be persistent or actually getting bigger, and obviously if you have swallowing problems or discomfort, any type of obstruction that you can feel like that's persistent, definitely get that checked. You do not want to let these things sit. So be sure and get in to see your dentist. Twice yearly is a good way to have that screening done. You may not realize it, but when you're seeing your dental hygienist or your dentist, their eyes are always scanning the tissue. So you may think that they're taking care of your teeth and your gums, which they are, but they're also taking a look at the soft tissues of the mouth and noticing any of these types of things that might be a concern to their eye. And then related to all of this, the fifth fact that's important to realize is that taking care of things early and getting them checked out can be all the difference between life and death, or extensive treatment and maybe something that's just fairly simple. So again, do not wait. If you have any concerns about anything that you're noticing in your mouth, it's just not worth it with these troubling statistics that we've seen with these different types of cancers. And so if you haven't been to the dentist for a while, or you need to find somebody to go to that you feel like you can trust, please reach out to us here at ExpressDentist, because we have a trusted network of providers that we can help you get connected with. That's what we're here for. And so please contact us and we'll help you get the connection that will keep you healthy and may even save your life. Most people don't realize that a dentist may actually help save your life. So feel free to reach out and take care, and all the best to you and your oral health.